머리 넣어보는 느낌이야.
All right. We'll get going. I'm sure other people will filter in a bit. And I'll try and keep an eye out for them as well. All right. All right. Don't hate me if I go through my slides like this. It's just so that I can see if anyone else pops online and then I can admit them. Okay, so thanks very much for making time this evening, guys. So the aim really today is just to sort of ping through a few questions and hopefully give you a bit of feedback and a bit of experience. Obviously, everyone's ACF interview may be different, but I've generally found that practicing, even if it doesn't turn out to be exactly what your own interview's like, is still relatively helpful. And I thought that just so I don't miss it, I thought I would flip through a few points which I wanted to make really. I promise I won't keep this long, then we'll just crack on. So this is clearly, I think, how everyone feels when it comes to doing interviews, and I've now done an appropriate number, and I still feel like this every single time. So that is normal. In interviews, clearly, it's not just what you say, but it's how you convey it that makes a big difference. And then very much how you convey it also influences what the panel hears. I'd say the two most fundamental things is that clarity in what you say and simplicity are important. So that is really about how you present the information. And that should let the content, the what, shine through where you want to convey the most unique and highest quality stuff you have. So, for example, if you've done anything on a national level, of course, that trumps what you've done at a regional level. If you've published a paper, that trumps giving a presentation. And thinking in advance about what you want to convey is really important. Some other people in the lobby. Okay. So this is what I would generally advise for anyone who's doing an NHS-based interview, so like a standard application to pediatrics or core medical training, sorry, IMT. And some of this will apply to academic interviews, but some of it doesn't. So there will be a structured scoring system, but there may be more flexibility. So there will still be domains or specific questions that the panel will have to score against, but they do get a bit more flexible in general in an academic interview to ask follow-up questions than they would in a purely clinical interview. In almost all the NHS interviews, they don't have your CV or application in front of them, whereas for every academic interview I've done, ACF level and above, they have had my application in front of me. I think the exception was when I did my London pediatrics ACF interview, they didn't. And I think that probably is because they had a large number of candidates to interview. So again, that will vary, but I have to say more often they have had my CV in front of me. However, never have I been asked, I can see that you've done this paper, tell me about it. It will always be an open question in the first instance. So the follow-on from that is assume they know nothing about you, because even if they have their CV in front of you, they may have only, some members of the panel may have only just got there 5 minutes ago, opened your CV, and then you're there. So you have to tell them everything you want. Usually, but not always, the people who interview will not necessarily the people you work directly with. So it is about kind of generic markers of excellence and demonstrating that you're a good candidate for them to invest in, rather than you demonstrating that you fit specifically into their research group. Of course, that is important and helps, but you're not necessarily trying to win the panel over because you're going to be their employee directly. I realize there's some variation with this, but usually that's the way. I think that this point is true for every interview I've done so far. If you prepare well enough, the questions are not surprising. There will be one surprising question in each interview, but for in general, when I've appropriately prepared, I haven't been surprised by the questions. And for most of them, by the time you've got to interview stage, either your shortlisting criteria only contributes small amounts to your overall score, or it doesn't count at all. So once you're there, really focus on the interview. So a few specific things. You've got to say everything you want them to know. So don't assume that because you've written something on your application or in your CV that they know it and will score for it. If it doesn't get said, it doesn't get marked. Always, if you're asked for an example, give your highest achievement. I had a paper published in Nature, as opposed to saying, I had a regional presentation at West Midlands Gastroenterology Society. And then when you're talking about kind of soft skills or non-technical skills, try and give evidence for them. So, if they said, what are your research skills? Then you would say, well, I am able to do basic bioinformatics. So, for example, I've analyzed bulk RNA sequencing as part of this project, which has gone into a paper. As best you can, try and deliver a complete answer to each question. So by that I mean, it's nice if it can have 3 points in a start and a middle and an end, but that doesn't always work out when you're in the heat of the moment, as it were. But try to draw your answers to a close within a concise time frame, which usually is 2 minutes or less, rather than kind of petering out and making them interrupt you. In general, people talk for too long for each question. I've always said 3 is the magic number. If they ask you, give us some examples of blah, 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 or tell us about what makes a good, whatever. Oh, a good hepatologist, for example, requires practical skills because they need to do endoscopy, academic knowledge because it's a complex, challenging specialty, and team working skills because you're working within an MDT with the dietitian and the physios and the surgeons. 3 is always a nice number. For clinical interviews, you'll tend to learn the kind of systems for, how you'd respond to a question about an error or, a drunk colleague. They can come up in research-based interviews. I would say they're less common. You might be asked more a kind of halfway house question, like how would you're doing a collaborative research project, how would you manage when a member on your team isn't pulling their weight? Which doesn't necessarily fall into the systems that you may have learnt for kind of more clinical interviews. And then, as ever, try and practice effective communication. So speaking clearly, directly, looking people in the eyes, and not mumbling as best as possible. So I think one important thing about making sure everything is said, be clear before you go into the interview is exactly what you want to convey. The last thing you want to do is leave and be like, oh, I forgot to tell them that I was president of the world. And that does happen, and you won't get scored on it unless you tell them. So in terms of preparing, everyone would have their different strategies, but this is what I've always done. Write a long list of questions, write out an answer to every single one, practice talking them to myself loads of times, and practice them with other people. And a combination of getting random people, medical, non-medical, people to fire questions at me from my list, and practice interviews, ideally with people who I'm a little bit scared of or not familiar with, to slightly simulate the anxiety. This is Colour Monster, who takes on the form of fear. Fear is obviously a normal emotion to be experiencing when you come to do an interview. So acknowledge it and keep going. So all you can do is your best. And I think it's important to acknowledge that you can do well and still not get the job. And that is unfortunate, but that's how it goes. So all you can do is prepare well and go through it. So those are my very brief sort of top tips. Has anyone got any questions from that, or before we kick off and go straight into a bit of Q&A? You can put them in the chat or shout out. Yeah, Siddharth.
Hi, good evening. Thank you so much for doing this session. I just wanted to know, are we allowed to have like cue cards and keep points? Like you said, that if we know what are the main points we want to speak about, would we be able to have like slips of paper or something with us?
Not for face-to-face interviews, but for virtual interviews, I think the party line is no, but I think the party line is no.
All right, thank you.
Because I think that sometimes, I'm sure they've asked you to like pick up your camera and show them around the room to check that there's no one else in the room at the time.
Yeah.
So you're not meant to, because they will meant to be able to check.
Okay, thank you.
The other thing is that you need to ideally seem slick, but yeah, so that's why when it comes to the interview, when I'm sat outside, I will try to only think of like 2 things that I want to mention. So for my most recent interview, I absolutely had to mention that I'd got 4 grants last year, and I absolutely had to mention this exciting new gene and my evidence behind it. And that, those were the 2 things I had to mention. It's like when I remember sitting outside doing an OSCE station, and there was always one thing I forgot. So for a respiratory exam, like I always forgot to examine the cervical lymph nodes. So I'd be sat outside and just be like lymph nodes, lymph nodes, lymph nodes. So if you focus just on those few things when it comes to the moment of the interview, you'll be fine. Okay, any other questions? Okay, so I have a big long list of questions that we'll rattle through, and I essentially just need people to put their hands up and I will pick on them, if that's all right. And if you are in a position and willing to put on your camera, then that helps. But if you're not, then that doesn't, then that's fine. Okay, so who's keen to get going?
I'm happy to be the first guinea pig.
Awesome. Thank you very much, Rose. What specialty are you applying for?
I'm looking for it's a dental one that I'm applying for, so not medical.
Okay.
Yeah.
Okay. Cool. Great. So could you tell us what would make you a good academic dentist, if I've termed that correct?
Yeah, sure. So I've had quite a lot of experience as a dentist, and throughout my time, in my spare time, I always end up doing quite academic projects and things like that. For the last year, I've been able to do a research project as part of my dental core training year. And that's actually given me protected time, so a session every 2 weeks to focus on a research project. And that's involved a qualitative systematic review, working with one of the consultants at the hospital. And as part of that, I've ran searches in various search engines, looked at a research question, and we narrowed down the papers to 13 papers that we're including in the review, and we're currently going through them and doing the thematic analysis. And I suppose it's this experience that's really given me the idea to apply for an academic route within dentistry, because I've really enjoyed it. I enjoy having a mix of clinical and academic, and I feel like my skill set is leaned towards both. I enjoy writing and researching, but I do enjoy the patient-facing elements as well. It's been really good to have protected time to do this. So in doing the ACF, I'd really enjoy having, a day a week protected time. And I feel like I could develop this project even further. Yeah, that's my answer.
Great. Okay. Thanks very much. We'll do kind of a few questions from a few people, and then do feedback in groups. So thanks so much. Okay. Okay. Anyone else?
I would
If not,
like
I'll
to
just
be
carry on. Oh, great. Was that Delia?
Delia. Yes.
Delia. Hi. Yeah. Super. Thanks. Okay. Could you tell us how your colleagues would describe you, please?
So my colleague would be describing as a responsible physician, and has been going on in all the 360 feedback that we need to do as part of training. So what pop out in the feedback is usually responsible, reach on time, give proper handover. From the professional point of view, a lot of people have described me as being obsessed with microbes. I want to do infectious disease and microbiology, and I'm one of those people who has a tuberculosis plushie on their pillow. So I guess that's it.
Okay. Is there anything else they would say? Anything from a research perspective?
Oh, that I never stop. I'm the one that involved in more clinical trials in the department. So most people are doing one or two. I'm doing recruitment for 5 different trials while having a full clinical job and not being a research fellow at all. So I'm doing more than the research fellow at the moment. So they think I am too obsessed with research.
Okay.
And that's
Okay, great. Thanks very much. And I mean, but if people just want to leave their hands up, that makes it probably easiest for me to find people to ask. And then, oh, great, Alex, thanks.
Hiya.
Hi. Could you? Could you tell us about one project and what you've learned from it?
Cool, that's a really great question. So I'm Alex. I'm going to be applying for public health ACF. I think the project I probably want to talk about the most is one that I did in my last job, which was as a clinical research fellow. And the reason I want to highlight this project is because I think it shows some leadership skills. I think it showed collaboration and also initiative and project management. So the project was I basically created videos for our migrant health clinic that one of the consultants just set up. We basically realized that there's a lot of people who come to our clinic who don't really understand the clinic, don't really understand how it's run. And so I thought it'd be quite a good way of bridging that knowledge gap of creating videos. So I basically came up with the idea, pitched it to my consultant, and I got the group together to create this idea. So I spoke to about 8 different teams, including volunteering teams, translation teams, the NHS Lothians video team, and obviously the clinic staff as well. And we kind of co-created a script and co-created videos together. So I think that shows sort of like leadership, collaboration, and then when I talk about project management and sort of time management as well, I think unfortunately I started this project about 2-3 months before I left, and I knew I was going to be leaving my post. So I basically managed to get the project to a stage in which the framework was there, and everything was kind of in place to get the filming going. And I basically just handed the project over to my to the next research fellow. I actually got an email this week from my consultant saying, "Hey Alex, we've finished these videos. We've actually created even more videos now," which is really exciting. And I love the fact that I've managed to start something and also hand it over effectively, and it's now kind of grown its own arms and legs, which is exciting.
And how will this influence you in the future?
So I think it was a really good sized project for me to start with, because it was small, and it was in a team that I hadn't met some of the team members that I spoke to, but it was an organization that I knew. And I think that's a really good place for me to start, because I knew the organization well. I think it'll be a good place to sort of start building on those skills, again, the project management skills and the collaboration skills that I've kind of built from this, to maybe scale up to either a bigger project, or bigger teams or longer projects from that point of view.
Yep. Great. Okay. Thanks very much. Okay. Super. So we'll do. Thanks for being the first three people who offered yourselves up. So, Rose, we asked you kind of the kind of class general opener question.
Yeah.
So, I suppose I felt that you went into a good amount of detail about the project that you've done recently, which, you know, clearly is a good part of evidence. But I suppose I would want a slightly more broader answer that was, if you're in an ACF interview and asked why would you be a good whatever, then I think you have to give one, like, be like, you know, I'm a stellar dentist. I've been progressing extremely well in my clinical things. I've been signed off. I've got total, you know, appropriate numbers of procedures. You know, so they first off, they have no question of your clinical competence.
Yeah.
And then from the research bit, I guess I would, if you're able to slightly frame that in a more generalizable way rather than the detail about that project. So I can't remember the wording even of what I asked you. I said, yeah, why would you be a good academic? So if you could say, you know, I'd be a good, you know, academic dentist because I you know, one of the key traits is being able to see a project through to its completion. For example, a project I'm currently doing is blah, 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 blah. This is where we're up to.
Yes.
The next step we're going to be, I've learned transferable skills, and, you know, moving on from there. And then, you know, your last point could be either a bit more underlining about the skills, specific skills you've learned, or you could pick up a new trait and, you know, talk about, you know, the statistics or whatever that's involved, or something very specific. But yeah, I guess I would have liked a little nod to, a bit more of a nod to like the clinical thing, just so that was acknowledged, and then use the detail that you used on the project to illustrate a couple of traits that no one would argue are important in research, which clearly you've demonstrated, but you just need to spell out.
Yeah, like elaborate a bit more.
Yeah, or like headline it.
Mm.
Yeah, you'd be like, I'm telling you about this project because, or to show that I am competent and committed, rather than yeah, nothing else.
No, that sounds good.
Yeah. Cool. By the way, anyone else, if anyone else has got feedback or thinks that what I'm saying is not reasonable, then please pipe up. Obviously, I'm only one person's opinion, so please do interrupt me.
Sorry, Dr. Malik.
And yeah,
Apologies. Just with regards to that question, I was told just in preparation of an answer to that, somebody recommended that I should, for example, just name 3 qualities that would be a good example for a good academic clinician, and then for each quality, give an example why you fulfill that quality. Is that a way you'd recommend answering that question?
Yeah, that's what I meant.
Thank you.
Exactly. So, you know, for example, why would I be a good academic pediatric hepatologist? I'd say something about strong clinically, whatever I can scope, and, you know loads of conditions or something like that. And then from a research perspective, I've got a strong track record, blah, 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 blah. And then, you know, from a personal perspective, I've had, you know, some fluffy kind of kind feedback. For example, a patient told me I was nice, that kind of thing. And then, you know, try and illustrate it with evidence all the way through.
Thank you.
Yeah, no worries. Cool. And then was it Delia? We talked about, what was the question I asked? Oh, how would your colleagues describe you? Yeah. So I realize that would be a slightly weird opening question for an interview, but it sounds like you've got absolutely loads on, I know we only scratched the surface, on your CV, which you didn't mention at all. So think of every question in an interview as an opportunity to tell the panel all the amazing stuff you've done that we don't know. So sometimes you have to slightly fudge like the answer to shoehorn in important things. Like it may be that, you know, they would say you're responsible professional and, you know, kind of very keen on research, but I mean, basically, I would answer this question almost exactly the same as the first question, you know, in the sense of I would have like a template answer for why I'm going to be a really good ID. Yeah. Template answer for why you're a really good infectious disease doctor and do research. And if you're asked directly, why would you be a good academic ID physician, then you just tell them. And if they say, how would your colleagues describe you? Will you say, well, they would say that I'm competent clinically, you know, I passed all my membership exams first time with high numbers, and you know, I've had very good feedback in my 360s, and patients like me or something like that. And then they would say, my colleagues would say that I'm absolutely obsessed or committed to infectious disease. And I would use more tangible examples for that. So things like, you know, my colleagues would say I'm obsessed with infectious disease. They know that I've been interested in this since, you know, FY1, when I first saw a patient with TB, and I've published 4 papers on it. I've done a 6-month rotation in it, and I've done a work experience placement and whatever else you've done. And then my colleagues would say that I am I don't know what the term would be, but perhaps you know, show great attention to detail, or good persistence, or good time management, or something. And then you say, my colleagues would say I'm excellent at time management because I can manage to be involved in 5 continuous clinical trials at the same time as my full-time job. The most important of these trials is, I don't know, trying a new regime for multi-resistant TB or something like that. That's the kind of answer I suppose I would be looking to hear.
It sounds amazing as an answer, honestly. It's completely different.
Yeah, but like, I'm sure you've got loads more stuff on your CV. Just, you know, that's the thing. You get a kind of soft question, but think of it as, how can I put evidence into the answer? Obviously, don't lie, but what I mean is you don't, just because a colleague says you're, whatever descriptive word, make it count for you. Does that seem reasonable?
It totally does. It was just I hadn't think about using a soft question as a CV question.
Yeah, no worries. Well, that's what this is for. And then, okay, cool. And then Alex, we talked about the kind of one kind of project. So I really liked the kind of level of detail you went into on the project, because it is easy to sometimes give too much detail and then kind of not get what it's about. And so I don't know if you've practiced this before, but it came across quite like you didn't have to talk for that long, and I think I kind of understood what you were on about. So I certainly would encourage everyone else to have practiced an answer for my project and like be able to say in just a couple of sentences what it is, so someone who doesn't know anything about your specialty understands. So that was great. The key bit for these well, the two parts for these sorts of tell us about one thing type questions is always, and next time I will, or the main thing I took away from this is, and like the single most important outcome from an ACF is getting funding to do a PhD, unless you've already done a PhD. I know some of you will have, but and I think that the traits that you described clearly are very important for public health type projects, but I think you could have just made that even better and said, for example, in my in working towards a fellowship application for a PhD, I would like to do more patient-facing improvement projects of this style, and I'm sure that the collaborative working that I've learned from this will be helpful. Something like that. Yeah.
Yeah, thank you. Yeah, I actually forgot. We did manage to get a little grant for this as well, but I forgot to mention that.
There we go.
Yeah.
So that was my other thing. I didn't know if you had a paper or a grant or something else or a prize to go with it, because again, often people will pick like the biggest and best projects they've done, and whilst you had a really nice description, a very critical person may say, well, I really like Alex's description, but we just had someone who had a paper in the BMJ, so like it was nice, but it wasn't world class.
Yeah, I kind of got a question about that, because like I picked that project for myself because I kind of headed quite a lot of it, if that makes sense. So I felt like I contributed a lot to it. I have been part of other projects which have had wider reach, if that makes sense, and have been published in sort of more international papers and things like that. I wasn't sure what I should be focusing on, whether I should be kind of focusing on those big papers or a project that, again, is slightly smaller like this one that I could show a bit more skills in.
I think that absolutely it's a balance, and if you had said I applied for funding from wherever and was awarded funding to do this project, that would totally change it, because then you've shown that your ability to go out and get funding to do it. Otherwise, it is quite nice to have a tangible outcome with projects. So I think even if something feels more important than even if it on paper you've kind of on paper, in reality you've led a project, even though it has been smaller, if you're able to describe a bigger piece of work that's been more impactful and published in good places, and you're able to describe what you've done and what you've learned from it, usually it's better, I would say. I mean, maybe if you're 58th author out of 200 on a Nature Genetics paper, then, I mean, even then, I probably would still say the Nature Genetics paper. Probably.
I have a question, if that's
Yeah.
okay. Like, just wanted to ask. So, I've done. It's a similar question to Alex's. I've done projects which have not necessarily led to a publication as of yet, but I do have a publication from a case report. In this particular answer, would you recommend I somehow shoehorn these publications, which may not necessarily be from the sort of serious research that I've done, but are from sort of smaller projects, or would you just say leave it out?
I think if it was a case report, I probably wouldn't necessarily try to make it around that. If you had a big meaningful piece of work that is sounds like it's heading towards a good outcome impact, whether that's direct for patients or simply from a fundamental science literature perspective, then run with that. If your outcome is a case report or a small case series, I probably wouldn't work it around that.
Okay, so would you say it's better to talk about previous research which you may not have contributed as much to but has resulted in publications, compared to a project which you may have contributed more to but has not necessarily yielded a publication yet?
I think the story has to sound impressive.
Yeah. Okay, fine. Yeah, that makes sense.
So, the story has to sound good, basically. So either one, as long as you can prove you've done a lot or said and learnt a lot from it, and then it's nice if it has a tangible outcome. I guess what you wouldn't want to do is say that I reviewed the 2 cases of this very rare condition and we published it in some low-level open access journal, and what I learned from it was, well, that you can do it. Yeah. So yeah.
Thank you.
Max?
Thank you. It was a similar kind of question. In terms of what would you prioritize, or on the flip side, what would an examiner like to hear more? For example, I've got 2 main things that I'd want to talk about. One is a first author paper in an international journal, and the other is an international abstract prize from a conference. So I'm not too sure what I'd want, like which thing to lead with.
In that case, it doesn't matter. Okay. As long as it illustrates traits that you have learned from and then can extrapolate on, and then in that case, it's more about just having a nice story, concise. To be honest, I would pick it almost based on which I can summarize in 3 sentences.
Okay.
And convey clearly. It's really about, a big thing in research is, I promise I won't go off on tangent too long, but like a big thing in research is finishing projects. It's really easy to start them, but it's hard to finish them. And that's why if you can go in and say, I did this project, I learned this, we finished it and we published it. And from that, I know that next time I will do this, then that sounds good. And it doesn't really matter if you say I got an abstract prize or I got a publication or whatever, it's the same.
Okay, cool. Thank you.
Yeah. Alex?
Right, sorry. Just another question about the projects again. Does it matter like how long ago these projects were? Because I guess specifically, I had done an internship with WHO back when I was a second, third year medical student, which did actually lead to like publications with WHO and with like US CDC. Not gonna lie, I felt like I peaked a bit too soon. That was like many, many years ago now. So do I still mention that? Like, obviously, I probably would still mention it, but it feels like because it was so long ago, is it even worth kind of like, have I grown from it, or does it look like I've not done stuff if I mention something so long ago? Makes sense.
I mean, do you have to tell them how long ago it was?
Presume not. No.
I mean,
Okay.
I mean, like, you obviously don't lie and tell them it was last week, but you know, say you can say that when I was a medical student, I was involved in a really career-defining project or career-defining so far, and blah 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 blah,
Sure.
and that, you know, that sounds great.
Okay.
I think.
Thank you.
Yeah. Amin or Amine? Sorry.
Hi, yeah, thanks. I just a similar topic again. About the what about the so in this type of questions, is it how important is it just to give one? Is it just to talk about one project, but like to talk about how does it sound if I will something upcoming in like next few months, which is I'm most proud of, but I haven't even started yet. Or like briefly mention something I get involved and had a publication, but maybe to end up something that will come in the next few months. What do you think about that? I just wanted to.
If the question is, tell us about a project and what you learned from it, I would, as best you can, try and talk about a project that is nearly completed.
Okay, and is it do you think is it also a positive, just like literally like one sentence to talk by, like also this is the project I'm really looking forward to, just to make a connection with the first project, kind of?
You can. Yeah, well, in the sense of, you know, what I learned from it, and next time I will be, you know, I'm looking forward to doing this, blah blah blah, but I wouldn't let that detract from answering the question.
Okay, thank you.
Yeah, if that makes sense. Yeah. Right, let's keep going. Can I have some more hands up for anyone else who wants to answer some questions, please? Don't all rush at once. Go on, don't make me pick on people. Excellent. Hey, great. Sorry, I don't know what your name's just come as VKM.
Oh, sorry, my name's Vinay. Yeah, sorry.
Vinay. Hi. Great, thanks. Okay, cool. So, you know, I can see from your application you've done lots of things. Could you tell us the 3 things that you're most proud of?
Yeah, so I'd like to divide this into kind of my most important kind of clinical work, and then my most important research project, and then my teaching experience. So clinically, I'm just very proud of having done. So I'm applying for a psychiatry ACF, from having pursued multiple cases in psychiatry, having completed an F2 in liaison, and then taking on further work as 20% of my teaching fellowship in psychiatry, and as a result publishing a case report on isolated cataplexy while working in a neuropsychiatry tertiary centre. Secondly, from a research perspective, I've been involved in a number of research projects. As a medical student, I worked in the TB research centre, which gave me exposure to laboratory skills such as using ELISA, and as a result, we were able to identify some additional cytokines which could be used in diagnosis of active TB. As a result, we were able to publish our results in an NIHR journal, for which I was a co-author. And then most recently, this allowed me to take up an academic foundation program in Bristol, where I developed my lab-based skills working on a psychopharmacology project, where we investigated how psychedelics influence sleep architecture and sleep neurophysiology in rats. And that project taught me a lot about how to use programming languages to analyze multidimensional data, which I hope to use as those skills to further my research as an ACF, looking at more in sort of human psychology trials. And then the last thing that I'm really proud of is my teaching accolades. For the last year, I was a teaching fellow at the University of Bristol, teaching third year and final year medical students. I was in charge of over 50 final year medical students, teaching them from sort of relatively immature students to becoming fully fledged, competent and excited medical professionals.
Great. Thanks very much. Okay, cool. We'll do a couple more questions and then come back to you. Cool. Anyone else? Well, I'm gonna have to pick on people I know. Great, Ahil. Super. Thanks. What specialty are you applying for, by the way, Ahil?
I'm applying for pediatrics.
Ah, excellent. What do you think the single most important attribute that a pediatrician should have is?
That's a really good question. I think from my clinical experiences to date in pediatrics, having completed taste-a-week sessions, as well as a 3-week career development period in pediatric allergy, I would say teamwork and working in a multidisciplinary team is the most important attribute for a pediatrician. I've seen firsthand how different members of the MDT work together. From my experience in pediatric allergy, this entails the pediatrician themselves, along with the psychologist who is providing advice and psychological support to children as well as their families with life-changing allergies. Also, the importance of a dietitian in providing dietary advice and key information in ensuring that anaphylactic reactions and allergies were prevented. And this is also applicable in research as well. As an academic pediatrician, I'll be working with other members of the research team, including statisticians, epidemiologists, as well as laboratory scientists. So I would say teamwork is the most important skill, and I've been able to demonstrate that in various roles and responsibilities, having served on committees, including the Pediatric Society at medical school, whereas the co-chairperson organising a conference for 150 people alongside a team of 10.
Super. Thanks very much. Good. And one more person, please. Max, can I persuade you?
Hello. Hi.
Excellent. Thanks. Could you tell us about what you're expecting from the training scheme?
Okay, so currently I am a pediatric ST3. So I'll be applying for an ACF at ST4 entry. I've had plenty of interactions with multiple recruitment universities advertised on the ACF post. So I know that, for example, in London, it's a pan interview for multiple institutions. I've had thorough talks with each of them to discuss potential projects. And because I'm entering at ST4 entry, I know that time will be kind of a limiting kind of factor. So I've had a chat with the ACF program director to discuss options for allocating the research time. And personally, I'd like to take it as a 9-month research block so that I can get fully into a research project with the respective team. And in that way, I can maximize both maximize both my research time and also potential output. And I know that the timing is going to be a little bit tight, so I'd like to maximize on the amount of stuff that I can do in order to plan for a PhD application and funding. In terms of funders, I would be looking towards getting funding from either MRC or NIHR. And additionally, there are other PhD programs advertised in the region that I'm applying for, which has a clinical salary for that PhD program.
And is there anything that you're expecting to get from the program?
So,
or from the training scheme?
So first and foremost, I've already developed quite a lot of research skills from my previous experience. And as I haven't had any dedicated research time already in my career, a lot of it has been kind of off my own back. And despite having no research time, I've had continued research output through papers and also international conferences and presentations. So knowing that I can manage a clinical job, having that dedicated research time will allow me to further develop my research skills. Currently, I'd say I'm quite adept at biostatistics, so using R to analyze kind of quantitative data, and I'd like to branch out into bioinformatics, and I'll be hoping to do that by using the study budget as well as the study leave to take up extra courses at the university to learn further skills in biostatistics.
Okay, great. Thanks very much. Thanks, guys, for answering. Sorry to pick on you, Max. Okay, right. Vinay, what did I ask? 3 things you're most proud of. I think in almost every interview apart from the one I did 10 days ago, I've always been asked what you're most proud of, or 3 things you're most proud of, or something along those lines. So be prepared for that question. I liked that you went for breadth across, getting one kind of thing from various different categories. I guess it felt like you covered quite a lot. And I felt like I had to work a little bit hard to pull out exactly what you were most proud of. So, for example, I felt like you could have led with, from a clinical perspective, I'm really proud of the work that I did during my placement at a tertiary neuropsych center, particularly with publishing a case report on cataplexy or whatever it was. I felt like I learned a lot there and demonstrated my aptitude as a psychiatrist. I know there's like other stuff in your CV, but I think that if they've asked you, what are you most proud of, I would try and be not to get too much in beyond that.
Yeah, I agree.
Yeah. And then with your research thing, like I think you could have either talked about the kind of ELISAs for TB project, or were you giving psychedelics to rats?
Yeah, that's right. Yeah, we were given. Yeah, that's right. Yeah.
Cool. Yeah, I think you could have talked about either of them.
Yeah.
But just pick one. And one way to approach this is, obviously I don't know what's on your CV, but like to pick a thing, be like, I'm really proud of when I was top in the year for psychiatry in my finals exams.
Yeah.
That demonstrates I've got good clinical ability. Or I'm really proud of this paper I got, or I'm really proud of the conference that we put together in the Medical School Psychiatry Society. And 3 kind of things. Or if you want to, which was still more sounding like for your research thing, you can describe it. I'm really proud of the work I did during this period of time. And I think that would have been a fine approach, but you just did 2 projects, so I didn't really understand which you.
Yeah, I agree.
Yeah. But you certainly talked about skills and traits in there which was fab. So if you're going to go down that approach, you say, I'm really proud of my work I did in the lab because I learned how to do ELISAs and analyze the data and integrate it into a paper. And then similarly, the teaching one, I felt like you just told me about your teaching experience rather than like what bit of it you're most proud of. Okay. And I don't know, I guess it felt like you just sort of told me that you did a teaching fellow job rather than I don't know, I surveyed my students at the end of the year and I got 95% of them said that they would highly recommend me to a friend, or something like that, or I got the best teacher award, or I've done my certification for Academy of Medical Educators or something like that. And I wouldn't, like, if I think that, for example, if you had 2 research things you were really proud of, I would just put in 2 research things and just leave teaching out of it for the minute.
Gotcha. Yeah.
Then these are usually scored on multiple examples of high level, like multiple examples of high level performance, or whatever the term is for that. And if you can say, I'm proud of my BMJ paper, my Lancet paper, my New England Journal paper, then that's a good 3 things to go with, even though they're like quite monothematic.
Yeah, gotcha. Yeah, thank you.
No worries. Yeah. Oh yeah. And then I'll ask you about another kind of general, fit with the clinical job one, attribute question. So I like how you included a bit about your experience and then how you'd come to that rationale, and a bit about how teamwork was important. I think, no one would argue that. If you hadn't said it, my follow-up question was going to be, and do you think you show the most important attribute as a pediatrician? So like, because again, this question, it's almost like the first question, what will make you a good academic pediatrician? But instead of you having the opportunity to say lots of things, you only get to say one thing. So if you pick teamwork, that's great, but I would try and pack it also with stuff. So, I like at the end you mentioned, I was on the committee for the Pediatric Society, and we did this and this and this, and that obviously demonstrates commitment to specialty as well as taking on leadership roles and teamwork. So that's good. But for example, if, I don't know, you got the pediatrics prize at medical school, then an alternative way to approach this question would be to say, I think the single most important attribute for a pediatrician is a strong knowledge of clinical pediatrics, because we manage, as a general pediatrician, every specialty to some extent. We are experts in rare disease as well as common diseases. I show this attribute because I was top of my year in medical school for pediatrics, and I did well in my OSCEs, and I have a good understanding of rare disease, and that will make me a good candidate for this job.
Just one question, if that's okay.
Yeah.
Would saying commitment to the pediatrics in itself be sort of a sufficient enough response, and then use that as a way to, I guess, cover quite a few different achievements, such as prizes, but as well as, research works and I guess, taster weeks, etc.
So, as part of this question, if they've asked you, if you've been asked like what is the single, or what is the one, blah, 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 you do need to come out with a clear one point. Otherwise, it's kind of irritating on the panel.
Fine.
What you say after that, anything goes, as long as it illustrates that point. You wouldn't want to go off on a long tangent about taster weeks for a long time. unless it illustrated why whatever the single attribute is, if that makes sense.
Sure, that makes sense. So
Yeah.
one key skill, and then try pack in as much as you can in terms of your what you're able to bring in your own experiences.
Yeah, I mean, I guess the way that I had prepared for this is that I prepared all permutations of the why am I a good candidate for this job? Why should we hire you? What makes you a good pediatrician? What is a good pediatrician? And basically had 4 or 5 traits which would fit into each question, and I knew for exactly each one what evidence I would supply for it and justification I would give. And if I was asked just one, which one I would give. So I knew there was no thinking involved. So
Sure, that makes sense.
Yeah, you may have prepared this before, you may not have, but for example, now would be an opportunity to think, right, if I'm asked what is the only one thing that I can show that shows I'm a stellar candidate, but also a reason I'm a good pediatrician or will be a good pediatrician, what is the one thing I would say? And then you need to make everything out of the story fit. I realize that's a little bit contrived and backwards, but as long as it sounds natural when it comes out, then it's fine.
Thanks.
Cool. Again, anyone else, feel free to chip in with questions, put them in the chat, whatever else, any other time. And then Max, yeah, thanks for letting me pick on you. So I guess what I had meant was a bit more about I think you sort of described in detail what you would do on the program. I guess I'd meant a little bit more tell us about what you expect the program to do for you, which you did answer, but the other way around. I guess the one thing that I think just needed stating was that 75% of your time is clinical work and you're trained to be an excellent pediatrician. Just need to say that at the start. And then from there, like I quite liked, I mean, we've chatted before, but like I quite liked what you said at the end towards, in the rest of my time, that the main thing that I'm going to get from this program is dedicated time to work towards a PhD, exactly what you said. And then you had told us all the other steps, and clearly that you understood the what was nice was you gave a lot of specific detail to illustrate that you knew why you were applying to this particular program, and you'd thought about funding options and labs. And I think that if you're asked a question about what you're expecting to get from the program, having thought about how you would use the study budget as well is really good. So yeah, those are the kind of things.
Cool. Thank you.
Yeah, cool. No worries. Okay. I have a few more questions if I have a few more people who are willing to answer them. Anyone? Or equally, if anyone who has previously answered questions is happy to answer another one, then that is also great.
I'm happy to answer another one.
Okay, thanks. Super. So, Rose, how do you anticipate balancing the clinical and academic work?
So I feel like I've had quite a good chance with this over the past year. So I've been doing a training role that has an academic component, which is every 2 weeks, and I find with my time management, we used a Gantt chart at the start of the project, and I find to-do lists really helpful, and I write everything down in my diary. I do have quite a lot to balance with work, home life, because I have 2 young kids, and the academic side of things as well. One thing that I've got a lot better at is, because my academic portion is done at work, I often had people sort of wandering in to chat to me a lot, or I might get called away because there's an emergency. And obviously, if there's a 5-year-old patient with a swelling, that does take precedence, but that would also mean that the work I had planned to do, I'd maybe have to do in the evening or something like that. So as I've progressed through the job, I have been better at being a bit more assertive with staff, just say, oh, I just need, you know, to be left alone for these 3 hours or whatever it is to really focus. And I find that if I do have quiet space, it's a lot easier to get whatever I've planned for that session done. And I would also say that in terms of tasks, I like to complete a task and then move on to the next one if possible, so that I find that that's a lot more efficient for me, and I find that I can get things done a lot better with that. So I'm setting myself clear goals and meeting those goals sort of on my own timetable. Previously, a lot of the projects I've done in my own time, and that's just been the nature of the job that I've been in. So I'm quite used to fitting extra things in where I need to, and I quite enjoy aspects of academia that I've done, such as reading and things like that. But ideally, I do try and plan everything so that I can get what I want to get done within the specified session.
Thanks. If I can just ask one follow-up question to that, how would you respond to a full-time clinical colleague who says that you are burdening them with extra work because you're spending your time doing research?
Well, I suppose I'd try and understand their point of view initially. So if they said something like that, it sounds like they're probably a little bit stressed with their workload, and maybe have a chat about what the ACF position actually entails and what it means, because they might not really understand about the protected time for research and how it works. I think one thing that I'm aware of for the training program is that time can sometimes be added on to the end to make up for lost clinical time. So, you know, explaining that to the colleague that sometimes the training pathway I'm on might even take a bit longer than theirs as well. And then maybe just seeing if there's any way that I could help them if they are getting patients lumbered on them, which they think should be for me, you know, what's going on with the organisation structure, and is there any way that we can try and find a way around that so that they're not feeling so stressed.
And who would you go to if you needed some support?
Well, I'll be working quite closely with the academic supervisor, so I'd have a chat with them if I did have problems from other trainees like that, and also my research project supervisor, and as well also the overall training organizer as well could probably help out, because they'd be a bit more in charge of timetabling and patients and things like that.
Great, thanks very much. Okay, cool. There's a few other key questions that we need to go through, so I'm kind of hoping someone else will.
Yeah, I can go.
Vinay, great. Okay, could you tell us about what research you're interested in doing?
Yeah, so having completed my 4-month job in liaison psychiatry and then a little bit more during my F3, I became significantly more interested in patients with functional disorders and somatizations, or sort of the medically unexplained symptoms which other physicians seem to shudder at. And I think despite my previous research being around psychopharmacology in rats, I would like to pursue some further research in this particular cohort of patients. I know at this particular university we have there's an academic unit and a neurologist and a psychologist who are particularly interested in non-epileptic attack disorder, and I would like to get involved in a project. We've discussed a possible project around psychological subtyping of these particular patients, as I believe that there is currently an unmet clinical need around how to address the underlying psychological issues of this particular patient cohort. So I'd use some of the previous skills and qualities that I've learned from my lab-based research projects around analyzing complex multi-dimensional data, but in a very different form, looking at sort of human populations using both qualitative and quantitative data.
And do you have a kind of a timeline for what you expect to do over the next few years?
So I understand that the ACF is a 25% protected research time, which allows me a cumulative amount of 9 months. In this time, if I would have to discuss it with a potential research supervisor as to what is feasible in that time, because it's not a huge amount of time. But being able to develop some preliminary data, which would allow me to apply for grant applications through a PhD, I think would be sufficient to do within that time, which hopefully should at least be a sort of pilot project or a protocol that I could develop for a more substantial research project for a doctorate.
Okay. And do you have a specific time in mind at which you'd like to do a doctorate?
Well, ideally immediately after the ACF, so I'd be applying for fellowships the year before.
Okay, great. Thanks very much. Okay, super. I just need 2 more volunteers. I promise these are straightforward, non-mean questions. Brilliant. Narod?
Hi, yeah.
Hi. Could you give us an example of some teaching you've done?
Oh God, no. Sorry, I didn't say that.
Okay. Well, okay, I can give you a different question then if that's a really bad one for you.
Yeah.
Different one, fine. Can you tell us where you see yourself in 5 to 10 years' time?
All right. Yes. So I'm an aspiring academic neuropsychiatrist. So my plan would be to complete this ACF and to potentially get the PG cert that is offered locally here, if possible, of course. And after amassing, enough research experience and publications, I'd like to, and of course, finishing my membership exams, I'd like to apply for a doctorate afterwards, and that would probably take 3 to 4 years full time. So that would take us to about 5.5-ish years from now, maybe 6. And at that time, I would be hoping to get onto a clinical lectureship. If that isn't possible, I could always re-enter training at the ST4 stage and reapply for a CL post afterwards. And ideally after that, there would be intermediate fellowships which are offered at the NIHR or the Medical Research Council, but that would obviously be after CCT. So I think that would be quite far away. But generally speaking, I'd like to go down the full academic route, but I very much still value the clinical aspect of psychiatry and especially neuropsychiatry as well. So I'd like to retain at least 20% clinical time throughout.
And what do you think the key steps are in getting where you've just described?
Well, I guess the key steps would be to sort of to progress at each of the stages, which of course is very competitive and quite difficult. So I think the most important thing is to maintain perseverance, because academia many times can be quite challenging to make sure that you tick all of the boxes, and especially balancing that alongside the clinical time as well.
Okay, yeah. Good. Thanks very much. And then I'm sure someone else I saw a hand flicker up as well. Was that Alex? Yes, great. Right. Alex, could you tell us about some teaching that you've done?
Sure. So my last job as a clinical research fellow, I actually did a sort of teaching program with 2 other clinical fellows, where we taught 4th year medical students. So they were first year of clinical work. And we did like a 6-week program with them while they were on the infectious diseases board. It was really fun. We actually created teaching material and we asked them what they wanted to do and how they wanted to sort of structure things. And because students run sort of 6-week blocks each time, we could sort of tailor each block and work on the feedback that we got from each block for students. It was a really nice mix of bedside teaching. So I did some like neuro teaching, for example. I also did some simulation teaching. So they wanted to do A, B, C, D, E's. And I also did sort of mini tutorials and feedback as well. So that was like my main teaching block. To sort of structure it or to sort of give it a bit of strength as well, I also did a clinical education program alongside that, so to sort of educate me on how to educate other people. And I did that for the time that I was a clinical research fellow, so it was about 8 months. And that meant that I could sort of incorporate my the things that I was learning on my clinical education program actively. I could actively do that on the course with my students. And then the other little bits of teaching I did was sort of informal teaching with students. And specifically as well, I was supervising one of the 4th years on a research project that we're just publishing just now, actually. So we were looking at we'll do a clinical audit on people who use drugs and a new service that we set up for them. I basically helped the students sort of take her first few steps in research. So helped her with abstract writing. We prepared a presentation together at the Scottish Public Health Conference, and we co-presented that at the conference as well. So those were sort of like my main teaching from last year. I have also done some previous teaching before as a foundation doctor, but
Okay.
in terms of sort of answering that question, I think that's probably enough.
And could you tell us about some feedback you received and how it changed your teaching?
Yeah. So to be honest, the feedback I tended to get was not trying to be big heads or anything. It was generally quite good. People were quite happy with what I did. And I got it all recorded on a feedback form, so I can sort of give that to yourself as well. But yeah, generally, because it was small group teaching, people quite liked the sort of didacticness of it, or the sort of interactiveness even, sorry, of it. And they also thought I was quite enthusiastic as well. So that I also did teaching to other departments, so to other colleagues, and folks found that quite useful as well. So the teaching that I did to other departments was on the clinical research trials that I was part of. So specifically, I said I was in infectious diseases. We were looking at trials which had to recruit from general medicine and geriatrics. So I went to those departments and I did some lunchtime teaching to my colleagues in those departments. And the feedback that I got from that was it was really helpful for them. And also, I think it ends up being quite a good point of communication that if they had a patient, it actually did lead to patients coming from their areas to our studies. It just improved that communication, and it just meant that there was a friendly face that they could tag alongside the research projects I was involved in.
Okay, great. Thanks very much. Okay, right. Let's loop back. So, Rose, you've got the other classic question of the balance of clinical and academic. Again, now I have been asked this in every single academic interview I've been on, in one form or another. You know, it's always worded in a different way, but at some stage they always will ask you about this thing. So, in general, I really liked your answer. I think that you acknowledged the difficulty of, if you're there, you tend to get asked to do stuff. If it's an emergency, of course, you'll go and do it, but otherwise you need to demonstrate your own boundaries. And you gave some specific things about how you manage your time. I think that the things that would be also good to acknowledge is how you would split your time. Now, this will be specialty and program specific, but for example, it may be worth just acknowledging and saying in this type of question that when you are physically in the hospital doing your work on the ward, your research work on the ward, it's hard to separate the two. And sometimes, therefore, having whole blocks of either weeks or ideally months away on research can help provide better distinction. Though some research projects kind of more suited to occasional Monday, Wednesday research, whatever, something like that. So you could have said something around that. And then this is, would always mention something along the lines of, if I'm struggling to find a distinction between the two, I need to get my academic supervisor and my clinical supervisor in a room to let them fight it out.
Yeah.
Because at your stage, it should not be your fault if it is not your fault if someone is dragging you to do a procedure on a 5-year-old with an abscess when you're meant to be doing research. So you acknowledge the difficulty, you do what you need to do, and then you escalate. And I mean, that question I asked you was a horrible question about, how would you deal with the other colleague? And I think that, very, very much liked how you answered it. Just need to say, if they're really mad, then I'll get my boss involved.
Yeah.
But yeah, nice answer.
What do you think about, because I know obviously there always is work that you have to do sort of weekends and evenings, but it's not ideal. But, is that something you should admit, or, because it's a bit of a funny grey area, isn't it?
I think that what they want to hear is that you will 95% of the time not let clinical work get into your research time.
Yeah.
It's only if the world is falling apart and there is no one on the ward and you're on the ward anyway that you would be willing to help out. But like, the main thrust of the answer has got to be, I'm applying for this job to do research, you're going to pay me to do research, I'm going to protect that time, and I will come up with a series of strategies to do that, including being 3 months away on research in a different room, getting my supervisors involved if I'm getting pulled onto it, the training program director if it's the fact that you should be an extra person as part of this role. They should they shouldn't be counting you in the rota, that kind of stuff. But equally acknowledging that there is a challenge there. So I think that I wouldn't we'll work in the evenings and weekends, but I wouldn't say that like it's okay if my time gets
it's
encroached.
almost full time management, isn't it? So
this is more about how do you protect your academic time rather than tell us about your strategies for time management.
Cool.
Has anyone else got any questions or comments about that one? It's a really common, like, you have to be ready for it in one way or another. Fine. Great. Thanks for answering too. And same for you, Vinay. So I really liked your description of your research. I thought it sounded great. I kind of got the gist. It sounded like you were interested in it and genuine, and you obviously don't have a complete project worked out, but that is totally fine. You were talking about the skills as well as the general area, and some acknowledgement of the kind of timeline. Sorry. I think you could have been perhaps a little bit more specific about. Oh, no, sorry, no, that's why I wrote down time. I liked that you were specific about the fact that you would need to apply for funding the year before. Yeah, I didn't really have very much else to say.
Nice, thank you.
I'm sure that there'll be some other people on the call here who will have like a really specific project that's already worked out that they're doing, and that's fine. Go with that. And some people will have even a less clear idea and be like, I'm just generally interested in psychiatry, for example. And then, the way to approach that would be, I don't have a specific project yet. I'm interested in these 2 or 3 things. So I plan to spend my first 3 months with doing 1 month in this lab and 1 month in this lab and 1 month with this group. And then based on that, I will discuss with the PIs and my supervisor, and we'll decide who I'm going to spend my subsequent 6 months with, or however you want to do it. And that is where I will generate my preliminary data for a subsequent application. And that would be another way to answer that question if you don't have a completely worked out project yet, which is most people. Like, that was the position. That was the position I was in when I applied for my ACF. Has anyone got any questions on that one? People often ask about it. Nope. Okay. Cool. And then Narrett asked about long-term plan. So yeah, I mean, I think you got all the right bits and bobs in there. I suppose I would have liked sorry. Who's got their hands up? Amine, was it a question about the previous one?
Yeah.
Go for it. Yeah.
I would like to. Yeah, I just want to ask. Do you think is it a stronger answer if you go like one specific group and specific team rather than to be genuine and say I would like to? Yeah, I mean potentially we can do both because we know the research groups and teams. But do you think is it a stronger answer if we say one specific group and one specific team rather than to say not sure?
I think that different people will have different opinions is probably the most honest answer. My personal opinion is that selecting the right group to do your PhD with is extremely important, and therefore I would like it really to hear that someone acknowledges that working with someone for a little while to get to know them and the team and what it would be like is important before you commit to working with them for 5 years. I say 5 years because let's say you do 6 months preliminary work, and then it takes you 6 months to write the application, and then you submit the application, and that takes a year, and then you do the PhD, which is 3 years. So I guess you could say, I'm just giving my personal example, like, oh, I'm applying to Cambridge because I'm interested in insulin resistance as part of pediatric steatotic liver disease. I know that there's expertise here. I'm particularly interested in the work that Professor Savage does with lipid droplets. And we've discussed doing a potential project around mitochondria. So I plan in my first 3 months to spend some time with Professor Savage's lab. But whilst I'm there, I also want to discuss with the other PIs in the group, including Professor Semple. I know his work on PI3 kinase, because I think that may also be a more interesting avenue. And then during that first 3 months, I'll just decide whether I do want to continue this potential idea of Professor Savage or whether I would be best suited in a different project different groups to determine where I'm going to go to generate my preliminary data towards applying to the MRC.
Thank you so much. Yeah, much clearer. Thank you.
No worries, no worries. Different people will have different opinions, but that is sort of how I would take it. Cool. Any other questions on that topic before we move on? Yep, Cherry.
Hi, thank you very much for hosting this, Jake. It's really, really useful. I just had one question regarding ACFs in general. This might be more of a logistic question. Or can you apply for the same ACF the next year, for example, if you give the interview and don't get it?
It depends what they define as the clinical entry point. It depends if you're eligible, really. Because some of them
So
are.
if it's like in ST3 and you've completed SCT1 and CT2, and you decide to, for example, take a clinical research fellow or a clinical teaching fellow year, you would still technically be allowed to go for an ST3 spot because that would be the next step in your trajectory of training. So is it basically they say if you decline the interview and you DNA the interview, then you'd still be eligible to apply next year, but does that still count if you've done the interview and don't get through?
I think that if you're eligible from a clinical perspective, then you're able to apply. The only time you wouldn't be would be, for example, if you did ST3 and then you couldn't apply for an ACF ST3 entry. Yeah, I think
that makes sense. Sorry if this is a tricky question.
No. I'm pretty sure that as long as you're eligible based on your clinical level, you're allowed to apply again. It's usually that people continue progressing clinically, but I guess I hadn't thought about between IMT and ST3. Yeah.
Thank you.
Cool. Yeah, sorry, Narod. I was just going to say, I guess I would have liked a kind of overarching framing of, I'm interested in psychiatry and long term, I want to make a major contribution to our understanding of whatever disorders, pick a disorder, or major benefit towards major impact on the care for patients. And I see the best way of doing this is as a clinical academic. Long term, I see myself having as a as a chair, working 80% research, 20% clinical, 50-50, whatever you want to say, that's fine. And then the steps in order, and then so like an overarching framing, and the steps to get there are which you did go through.
Yeah. My brain kind of melted when I was doing it because I wasn't sure which one I was applying to, because obviously each of the ACFs are slightly different. Like one of them has I think a pre-doctoral fellowship after ST3 if you're unable to get onto a funded PhD and that sort of stuff. So I wasn't sure to mention it or not, like that sort of stuff.
Oh, okay.
Yeah. Should I go into detail, or should I just kind of talk through the stages? I don't know how much detail to give.
I think detail is good in this answer, because otherwise it's very easy to just say, I'm going to do an ACF, I'm going to do a PhD, I'm going to do an ACL, I'm going to be a professor. So you need to flesh it out and make it sound specific to you, specific to your training program, acknowledging bits along the way. For example, surgeons, having to balance when they're going to get their procedures done and then not wanting to lose clinical competency around the time of becoming consultant and all that kind of stuff. And I'm sure that there's analogous stuff for you guys as well in psychiatry.
Yeah, because I think in neuropsychiatry, I've looked on the RC Psych website and they said that there's these 1-year clinical fellowships in neurology that you're supposed to do as well. So I wasn't sure if I should go into lots of detail and then a 6-month liaison psychiatry endorsement, that sort of stuff. So I don't know how much detail I should give, considering I might not even get to the ACF stage.
I mean, I suppose you maybe don't need to go into exact 6-month placements, but kind of a feeling for, all right, so I'm here, my ACF will take me 3 years. I would have liked you just to, I know you said it depends on the program, but I acknowledge a little bit about the fact that I'm going to apply for funding to probably NIHR and MRC. I may not be successful first time round.
Yeah. Okay.
But, I would aim to take time out of program between the 2 and 3. And then, I think that you can almost, so basically in 5 to 10 years time, you'll be somewhere post PhD, but early career researcher,
Okay.
ish, probably.
Yeah.
So maybe in an ACL, maybe not. So I think you said all the right stuff, but just I would have liked it framed and then kind of mapped out.
Okay.
That makes sense. Yeah.
Yeah. Thanks. Thank you.
Yeah. And I think you can also acknowledge uncertainty as well. So sort of saying, yeah, I may not get funding for my PhD first time round, and I'm aware that the transition from post PhD to intermediate fellowship is challenging.
Yeah.
And I'll be looking for guidance and support during that phase or something like that. Yeah.
Okay.
Yeah.
Should I mention about how time that we do clinically during the PhD can then be deducted from the ST 4+ years? I don't know if that would be relevant or not to talk about.
I would say that is too much detail to go into in the interview. I'm sorry, I know I just said go into detail, but that is really important, and everyone should definitely do it. But don't I wouldn't mention that.
Okay. All right. Thank you.
Yeah. Rebecca?
Thanks. I was just wondering if you had any advice on how to approach that question as somebody applying for an ACF post PhD.
Are you planning on applying for because MRC does do a scheme, I'm sure, that lets you do 3 years of research or something, an equivalent to CRTF, or will you just be going?
I'm an orthopedic registrar, so our options for funded research are a little bit different to that in medicine and pediatrics.
Okay, fine. So I guess would your plan be to take the 9 months, but divide it up as you want to, then eventually aim to go into an ACL and then start your own group?
I think so, yes. I think there are issues around the CL system for surgeons and how we get our training done in the 50% clinical component.
Yeah. I don't have a great answer. I think you just need to have because it's not clear, is it? There is no easy answer. And this is the phase that people find it is reported to be difficult bridging an earlier PhD to then the CL post during particularly a craft-based specialty. I guess in 5 years' time, I imagine you'll still be in training and will have some split of academic time, and then in 10 years' time, presumably you'll be out of training by then, or depending on exactly how things fall, or depending on how training gets extended. So I think you could acknowledge the fact that your next steps really will be applying for grants, which may include grants that will allow you to employ a research associate. I suppose if you want, I don't know what your depends on what your research is like, whether it's more clinical based or lab based, but if you're going to be operating, you'll need to think about how you're going to maintain research output and do the work whilst you're working 75% clinically, and then at some point plan for an ACL. And then, yeah, acknowledging probably also that training will get is almost always extended, certainly for surgeons, or at least some of my friends who are surgeons, when they've done an ACL at least, then their total chronological duration has been extended. Yeah.
Okay, so don't commit in too much detail to the kind of post-ACS plans, but just acknowledge various issues and various routes that exist beyond it.
Well, I mean, I think you need a plan. So whatever your plan is, I'd run with that. So at least the people who I know, I've got a couple of friends who are ENT surgeons, who post PhD, and did PhD relatively early, and they spent a period of time doing full-time clinical training, and then they managed to get onto an ACL later on in training, and they basically just applied for grants so that then they could have a research technician to support them doing their work, until the point where they were then looking to apply for a full intermediate fellowship. It's just difficult because it's a long time between PhD and intermediate fellowship.
Yeah. Okay. Thank you for that.
Sorry, that probably isn't the most helpful answer, but there we go. Sorry. Unless, has anyone else got any words of wisdom on that point? There's probably other people here who know more about that than I do. Yeah. Okay. Fine. And then Alex asked you about teaching experience. Yeah, that was a good, significant example. The things that you mentioned that were good. So you mentioned formal training, so that's good. That's like a tick box thing, which is on most of these feedback things. When you started talking about the audit bit, that felt a bit more like research supervision than teaching. I see how they're linked, but it felt a bit like a tangent. And then the other bit to always put into this is, one piece of feedback that I received is blah, 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 blah. And after this, I changed my teaching to do this. Of course, that feedback can be positive. So you could say, whilst I was teaching, students particularly commented on that they liked when I don't know, when we did sort of see one, do one, teach one in our practical sessions. And then for the subsequent 6-month block, I incorporated that every time, something like that. So yeah, I would try and include it, like the research project. What did I do? What did I learn from it? What will I do next time? It's just like that, but obviously for teaching and kind of more formally, what was the feedback you received? How would I incorporate it next time? Cool.
Cool, thank you.
No worries. Okay. I'm starting to feel like we've chatted for long enough. Has anyone got any other questions? Oh, there's some things in the chat. Fine, okay. No. Yep,
Can
Max.
we access the recording?
Oh yeah. I'll put the recording up and I'll send it round to you. Yeah. Yeah. And you can share it with anyone. It's fine. Yeah, Max, go for it.
Hi, thank you, Jake. One question that I did have was, so one of the ACF questions is essentially talking about a area of research that's not in your immediate area of interest, but kind of just to discuss a paper or something interesting. For that question, I was thinking of for example, because I'm applying for PEDS, I was thinking of looking at an adult paper, critiquing it, and then seeing if I can apply, or if there are aspects of that paper that I'd like to think or explore in relation to pediatrics. Would that be a reasonable thing to do? Or, for example, just trying to think of an example.
Yeah.
Like, I think there was a paper on the use of intravenous versus intraosseous access for out-of-hospital cardiac arrests in adults, for example. That I think has recently drummed up quite a lot of both positives and cons regarding that paper.
Yeah, I mean, I think that that wasn't one that we went through today, but is one absolutely to prepare. Is tell us about a paper. They may not be specific about. It could be tell us about a paper you are familiar with, but can be also tell us about a paper outside of your immediate field. And it almost doesn't really matter as long as it doesn't sound super contrived.
Makes sense.
As long as it's something that you can relate as to why you're vaguely interested in it, then that's fine. And I think that if it's a kind of New England Journal, JAMA, Lancet, BMJ type stuff that is quite applicable and understandable, then that sounds totally fine. And those are usually the sorts of things that I would pick up. Whereas if you like, I was reading Cell the other day, and and I'm really now interested in prioptosis and its role in whatever, some different specialty, then it sounds just random.
Yeah. Okay, that makes sense.
So it sounds fine. Yeah. Rebecca.
Thanks. I'm sorry if you covered this right at the very start because I joined slightly late, but it was just a question about the interview format. Because my understanding from what was on the NHR website was that it's a very, very structured interview. There are set questions. Some of the ones I've heard you ask tonight seem to depart a little bit from the structure I was expecting. How far outside of that published structure can they go in terms of what we should expect?
So my experience was that academic interviews tend to be a little bit more flexible than clinical ones. And now that can depend on the context and the specialty. So if it's a big area and they're interviewing for a lot of people at ST1 level, then they may be slightly more rigid. But if it's a smaller deanery in a more niche specialty, ST4 entry, something like that, then they may only be interviewing a handful of candidates. And then, yes, there will be specified questions that they need to go through, but there will be opportunity for follow-up questions. And I guess my experience on both sides of the panel for these type of interviews is that there is a little bit more flexibility than you would get in a standard clinical NHS interview is at least my experience.
Okay, fab. Thank you.
So obviously prepare based on what is on the NHR website, but I was just prepared everything anyway. Okay. Any other questions from anyone else? Yeah, Max.
Sorry, just one last question. So what happens if, for example, you'd like to do a project with a certain clinician, but they happen to be on the panel interviewing? Because would it not be kind of a conflict of interest? Because I think it's happened before in some scenarios I've heard.
I think that I mean, if, for example, you are clearly already working with someone who is then on the panel, then they will probably have to declare a conflict of interest and just stay silent during your interview and not contribute to you and not score you.
Okay.
If, for example, it's someone who you've had a couple of emails with, perhaps about, you know, would it be all right if I came and had a look around your lab and we have a discussion when I get to, you know, Brighton, wherever it is that they're based, then that probably wouldn't count as a conflict of interest. But equally, that isn't your problem. Like that shouldn't worry you. That is their fault. You should just give your answer. Of course, it would be a bit strange in reality to then be talking about, oh, you know, I'm interested in working in, you know, Professor Jones's lab, but who's sat right there.
Yeah.
You do you, and let them worry about how they manage it.
Okay, cool. Thank you.
Yeah. All right. I think we're gonna call it a day there. Yeah, I'll email around the recording to everyone, and well, good luck. And yeah, feel free to email me if you've got any questions or if you think I can help. And I'll email you all my list of questions that I tended to prepare. It's probably a bit long and a bit rambly, and I've pulled it from various places, but yeah, we can go for it. Okay, thanks everyone for taking part, and yeah, good luck.
Thank you.
Thank you very much.
See ya.